I want you to get ready to embark on a transformative journey where there's no more suffering in silence, no more conforming to outdated societal norms. This is the podcast where we dare to crush those societal expectations and embrace the realities of pregnancy and parenthood with one honest conversation at a time. It's time for us to rise above the shadows and ignite a movement towards a happier, more fulfilled world for every parent and child. If that's you and you're ready to challenge the status quo and embark on this incredible journey with me, then I'd like to welcome you to the Birth Junkie podcast. Today I'm chatting with Dr. Sarah Tillay. She is a board-certified physical therapist who is specialized in pelvic health. She is the founder of Floored Pelvic Health and Wellness. She is passionate about educating women as a way to empower them in making health decisions. I love that so much. And I think that pelvic health is so much more important than we realize. So I would love to definitely dive into that, but I'd love to hear your birth stories too.
Okay, great. Well, I think the start of things, knowing what I specialize in and what I do for work is helpful as it kind of leads up to my mental headspace before going into delivery. I work, just like you work, with a lot of women who are pregnant postpartum, have been through births, multiple different varieties, different complications, whatever. And so I know a lot in my head, but I hadn't really gone through it before for the first time. So backing up before getting pregnant, my husband and I struggled a lot with getting pregnant. So we were diagnosed with infertility. And we went through multiple miscarriages, multiple doctor's visits, just the whole gamut of everything. And then we finally were pregnant. So the pregnancy was already filled with lots of trepidation and is it going to stay, and the fear and the worry that comes with all that. And that's a whole podcast in and of itself, is just with anybody who's gone through any of that journey. So we made it to term. I was planning, I thought my body was ready and all the things, but it was during COVID time. And so we weren't allowed to have an extra person. My husband was the only one. Well, only one person was allowed, and I wasn't going to swap him out for anybody else. So I didn't have a doula in there. I didn't have my mom in there. I didn't have anybody else that was part of that support team that would have been really helpful in hindsight, looking back. I really didn't think there was going to be any issues, unforeseen issues. That I hadn't planned for, which that's not how birth goes, you know? Right. And so my pregnancy was miserable. I had hyperemesis gravidarum, which is, for those who are listening that don't know, is basically really severe nausea and vomiting for a very prolonged period of time. And I was off work, laying in bed for like 4 months. I just was throwing up all the time. So it was pretty miserable. So I started off that pregnancy going from probably the most in shape I've been in my life to probably the most deconditioned I've ever been in my life, going through all that during pregnancy, leading into a labor and delivery process, which I did in the hospital with an epidural. The epidural was something I didn't know I'd want quite so early, but it was just a really intense process that, you know, you're just kind of in your headspace and you're tired, and I was just ready for it. So I had my epidural put in. It only numbed half my body for a while. So then I had to have it redone, which is always, you know, the joys of in the midst of things. And that was fine. So I get to the pushing phase. I thought everything was going great. And I ended up pushing straight for 4 hours, which is a really, it's a prolonged stage of pushing, which as a doula, I'm sure you know, and that's a lot. So I was exhausted. She ended up flipping partway through. She was in correct position, but she flipped over. So she was quote unquote sunny side up. Mm-hmm. So face up, which just makes it harder. And after effects of all that was prolapse. I'm already a stretchy, bendy individual, which sets me up for at risk of prolapse. So I've got different types of prolapse, and most significant was complications with my healing. So I had something called granulation tissue, which I don't know how much you're familiar or the listeners are familiar, but basically at the site of either tearing or a episiotomy, which I tore, which is only a grade 2 tear, which was great from a PT perspective. We want 1s and 2s. My body ended up trying to heal excessively, if that makes sense. And so this extra tissue that's super granulated, super nerve innervated, I should say, can easily break open and bleed, very sensitive to touch, started forming. And it wasn't just a small amount like I typically see that normally heals up on its own. it was a very large amount, and it took probably 4 different times I went into the doctor to have it burned off. And that was extremely painful. And it left me after probably, I think it was finally gone at 6 months postpartum, but I couldn't stand for more than about 5 to 10 minutes without really severe pelvic pain because of how sensitive that tissue was. And so it just set me up for a lot of really bad mental health. Like, I was not in a good space mental health wise, and finally got in online wise, got in to see a counselor, psychologist, and that was so helpful. But that's probably some of the darkest days I've ever been in. Postpartum was just adjusting to mom life, dealing with constant pain. I didn't expect that. It's not a very common thing that happened to me postpartum that happens to a lot of women. So that was hard. It was really tough. And even though I wasn't in constant pain after that 6 months of dealing with that granulation tissue, I still had pain with sex because of that. It basically limited a lot of the pleasure and the joy of that. Like going on hikes or walks, which I enjoy so much, I could only do for a short period of time because it would increase pain still after a while, etc. And then I got pregnant again. So basically 10 months postpartum, I was pregnant again. We didn't think we could get pregnant. So it was a surprise pregnancy, and which is great. And I love my son. I'm so grateful. But it definitely was a little sooner than I would have expected. And so that pain built again during pregnancy with a load of the baby and everything on it. And so my prayer was that after delivery, there would be just some miracle where it would resolve itself. Otherwise, I was going to go in for, they excise the tissue. Basically, you go in for an operation and they cut tissue off of wherever that granulation tissue growth was, where it's extra sensitive, and hope that it won't regrow and hope that it will solve the pain issue. I was not looking forward to it. Right. So I guess I'll kind of segue that into the second pregnancy and birth, because it kind of meshes in a little bit, and we can get any details you want from that. But again, miserable in pregnancy, pretty nauseous, vomiting like 8 times a day, but it was for a shorter period, and I could get out of bed and function and pseudo care for my 1.5-year-old or 1-year-old at the time, I guess. So I didn't have to go to the hospital for fluids, so it was a little bit better. But I'm just an unhappy pregnant person. I just don't. I don't love it. Yeah. So I was pregnant with my son, and just uncomfortable, growing pain and discomfort with the growth and weight of the baby, especially on that tissue that was super sensitive. And then I got to my 37-week appointment. Side note, my daughter came 2 weeks early. So my son, the 37 weeks, I was like, well, I might have him early. I don't know. You never know. Went in, I was dilated to a 3. I was like, it's probably going to be a while still. She said, okay, wait at home for at least an hour before you come in if you feel contractions, because I was going to deliver in the hospital. And planned to have an epidural again. That was what I decided to do after the last one. And I had prepped my body a lot more this time. I'd done all the things that I coach clients to do, and everything's just like, please, body, cooperate with me this time. That would be great. And that night, literally that night after that appointment, I was like, I don't feel very good going to bed. This is 37 weeks, it was 3 weeks early. And I was like, it's probably just me being silly. I'm just going to go to sleep. My body will wake up if I'm going into labor anyways. It's fine. I hadn't even packed my hospital bag yet. I was like so behind the times. I had, a 1-year-old at home. So it was a lot going on. And at about 1:30 in the morning, I woke up and I was like, I'm just really uncomfortable. I should just get up and pee, whatever. So I got up and peed, came back to lay down, and I was like, I think I'm having some contractions, blah, blah. Let me just download the tracker, do the things, it's probably time anyways. Didn't even wake up my husband. 20 minutes went by and I was like, ooh, these are clocking at 2 minutes apart. I probably should wake him up. Like, we were already there. Like, it went really fast. Because I was like, I have an hour at least, whatever, it's fine. We had to call the babysitter to come over. She only lives 5 minutes away, but we had to wake her up, and we couldn't get a hold of her the first few times. Anyways, it was a whole hullabaloo. But from then on, basically, I was like, this is real. This is happening. I was like, had maybe a minute to maybe a minute and a half where I could like walk around and try to grab some stuff. And then it was me like doing the rocks, my body was getting ready. So we got in the car, babysitter came, daughter was still sleeping. My husband was, I'm sure, speeding, but it didn't feel fast enough to me. And I'm trying in between contractions to call the hospital saying, we're coming in, we're going to need help. Like, I'm not just going to walk in there like, I think I might be having a baby. I'm going to be having a baby. So I need you to be ready. Called the wrong hospital to start with. I wasn't really thinking clearly. Then called the right one. As soon as we got off the phone with the hospital, with one of the nurses on staff or whatever, my husband was talking to them. My water broke, just like full on gush all over in the car. It was kind of a mess. And I was like, my water just broke. My husband's like, okay. And I was like, and I need a push. And he's like, what? And I'm like, I can't help it. Like, it's coming right now. Like, we're doing this right now. So we were about 5 minutes away from the hospital. We pull up. I'm like actively pushing in the car. He runs over. It's locked. You know, you have to push a little intercom. Hey, my wife's having a baby in the car. They're like, tell her not to push. I'm telling you not to push. Like, what are you talking about? I was like, I can't not push. This baby's coming out. So they stand me up. It's like 2 a.m. Not, yeah, almost exactly 2, maybe a couple minutes after. They stand me up, rip my pants off in there, just to check and see. The baby's not quite, like, the head's there, but it's not quite coming out. Put me in a wheelchair, wheel me in, get me in a bed, rip my pants off, sit me up. I don't really know what's going on. As I'm getting wheeled in, you're in the delusional pain stage, right? You're like, I don't know. I was like, I wanted a epidural, and everybody laughed because obviously it was well past that time to have an epidural. And they got me sitting up in bed, and I was like, I want to deliver on my side because I'm like, this is the just in case. I want to stretch I want my hips to be in the right position, all the things. Anyways, and they're like, girl, there is no time to get you on your side. And I pushed maybe once, maybe 2 more times, and there he was. Voila, he popped right out.
Wow.
Yeah, it was pretty wild. It was bad. Like, less than 5 minutes, probably 5 minutes, we were at the hospital and the baby was out. So from start of contractions when I woke up to finish, it was about an hour and a half.
Wow. That is a really quick labor.
Very fast. But from a pain standpoint, night and day postpartum recovery. So different. At 2 months postpartum, I was out having walks. I was like, I could go back to the gym. I'm feeling like, within reason, obviously, with the appropriate like exercises, but I couldn't even stand really with my last one at that stage. Like, I was just in so much pain. So it was so different. My mental health was so different. I was already chronically fatigued. So like, that was, I'm like, I'm already tired. What's the difference? So it really just was a huge change. And I did have prolapse that got a little bit worse, just probably from during pregnancy in and of itself, not from pushing. But the pain was gone. So that was just, for me, night and day reality right there. It just stretched all that tissue out, and it did enough of a reset that I don't have to have any type of surgery, which is so great. So
that is amazing. So yeah. I have a few questions along
Go ahead.
the way.
Yeah.
So, okay, you said that your baby was OP, so posterior, right? And you gave birth to her that way, right? So she came out sunny side up.
Her face was all bruised. She was all had gotten wedged in. She looked kind of like a mess. It was.
Yeah, because okay, so I mean, yes, I know that OP babies, they normally do take longer to kind of come down and out, and sometimes pushing stage is longer. But I know a lot of doctors will tell people, like, you cannot birth your baby in that position. Like, your baby will not come out.
Yeah. Well, I was super thankful that my OB, like the one that I was seeing throughout the whole thing, and who was super supportive of pelvic floor PT and like all the things. We chatted a lot about some of the preferences that I had, and she was the one that was on call for that weekend. And so she was the one that actually delivered my baby, which was so great. And honestly, I think if it had gone much longer, I wouldn't have had the strength to be able to deliver that baby. So if it had been another 20 minutes or more, I don't know that I could have actually pushed hard enough. Like, that's just a long time to be pushing with, like, in hindsight, looking back, what I would have done differently in advocating for myself had I been the one advocating, right? You're just in your head, you're just in your zone. Like, you can't when you're the one delivering. Even though you wish that you could. My husband doesn't know the things I had. He was being as supportive as he knew how to do. And I couldn't coach myself. Like, you're just in the space of birthing. So looking back, I would have said, hey, we need to just stop pushing. We need to let the uterus do some work. We need to let the uterus push this baby down a ways. We need to give you some breaks. As long as, it's not painful, you're not like in agony and feeling the need to push a ton, just take some breaks, like wait a while. I know that within the doula space and within the pelvic floor health space, there's so much we know about that. But I know that many, not all, but many within the nursing and hospital-based delivery, they tend to coach pushing when you reach a certain level of dilation.
Right.
And when that baby seems to be in the right position and you have an epidural, right? Because you're like, well, you must not be able to feel. They kind of just coach that pushing start right away. And that's not necessarily, obviously there may be reasons, talk to your medical provider, et cetera, but there may be reasons to actually wait and to let your body get more prepared. If you can feel, obviously there comes a time where you do just need to push, but if you were unconscious, your baby might actually just come out anyways, you probably would deliver. So a lot of it just comes down to how we're coached when we're in that type of a setting, specifically when it comes to the epidural. Because obviously when you don't have an epidural, it's different. You're normally delivering in a different space, or you can feel things differently. It's just a different kind of experience. My epidural was basically, they turned it off by the time that I was delivering. I didn't have really, there was very minimal amount of pain relief by that point anyways. And so I was like, what was the point of this? Like, what's going on? Anyways, so that's a whole side thing. But the second birth experience, even though it was very intense pain, right? Because you're delivering that, but it was shortened into such a condensed period of time. It was so short that I was like, that didn't feel traumatic at all. It's almost like this amusing story I tell. Like, I can't believe I almost delivered a baby in the car. Like, literally, if I'd been in there 5 more minutes, the baby would have been out. Like, I would have been like, oh my goodness, what do I do with you? So it was just a really different experience. And the knowledge that can come with educating yourself and your partner, and if you can afford or you want a doula to help be the advocate for you, to help what might be most helpful to your body, and not to go against like doctors' recommendations and like safety, but to be your advocate, to coach you on things, to help your delivery experience. Because none of what I did during that pushing phase was medically mandatory, other than like the end actually getting the baby out, right? Like that needed to happen. She needed to come out. But right. It could have been very different. And so in hindsight, there's a lot in that maybe 3 hours before like that last hour period of time that I would have changed, and given the opportunity to have another body or another person there. Yeah, your mind's not thinking super clearly in that. If you're listening to this and you have never delivered a baby yourself, like been through that, your head is not in the same place as it is right now. Okay, unless you're literally listening to it while you're having a baby, in which case maybe. But yeah, it's just different. So there are times when the health, like they're monitoring vitals, etc., especially in a hospital setting, they normally have you hooked up and they can hear baby's heart rate and whatever. And so if there is a lot, like they can't change and keep baby's heart rate where they need it to be by changing positions, or you're having problems with blood pressure or passing out or whatever, like there are reasons why they would be like, hey, we need to hurry this along. Okay. Right. But if those aren't happening and they're just trying to hurry you along because they think it needs to happen in a certain amount of time,
that was it.
That is, you can refuse that. It's hard because they are pushing at you, and it really, even if you get what you want, but they're pushing at you, it changes your birth experience, right? It changes. You're like, oh, that was so stressful. Right. That was probably the most stress. I mean, it's already stressful, but all this pressure from other people telling you, like, if something does end up going wrong, you're going to feel like it was your fault, even though there's really no medical need to push things any farther, other than maybe they want the bed, or they're like, well, it's been 16 hours, so you got to get out of here. It's been long enough. I don't know. So yeah, really advocating and understanding the why behind some of their medical providers, because some people have midwives in hospitals and some people only have OBs. So it just depends. Different providers deliver in different places, but there's also hospital policy. So asking your doctors the right questions before you get to that point, knowing like what is maybe that's what they have, that's their policy. It's hard to go against hospital policy. So you may want to ask that early on, but it's hard to know if you don't know what to ask.
It is. So. And as a doula, I always, I either ask or I invite my client to ask, but why? But why does this need to happen? So that they can have a better understanding, and what are the benefits and risks of this, so that they understand the full picture. But in the moment, and especially if there's like a mom there that's kind of like, just do what your doctor says, then that's hard.
Yes.
because then
It's
it's like your mom is telling you. So yeah, it's
Well, and
sticky
people think
situation.
they think, oh, my mom's delivered XYZ amount of babies, and so she knows. Well, your mom knows her experience, right? She knows what she went through, but unless she's somebody who's fully trained in a lot of things, which is not many,
Hmm.
she probably doesn't actually know as much as she thinks she knows. She knows experientially, which is knowledge, which is great. And it's nice to share. That's why it's so fun to share birth stories and things.
Hmm.
But there's the background into your medical history, what was going on with your body, what was going on with your baby, what risk factors are there, where are you delivering, etc. That is
Exactly.
different for
Oh yeah,
everybody.
for
It's not the same.
sure.
Yeah. You can't
Yeah,
line it up.
I know. And it's really hard to navigate. But
Yeah.
so, when there is an OP baby and you are pushing, do you feel like that attributes to that pelvic floor prolapse or like the tissue,
Yeah,
what do
that's a
you
good
call it? Tissue
question.
granulation that you talked about?
Yeah, granulation tissue. So
Yeah.
just to talk a little bit about granulation tissue in and of itself is not bad. You like if you have a burn or a wound, that a large wound, and it needs to kind of get this tissue that heals inside of it. Granulation tissue is what that is.
Hmm.
It's the first phase of healing that has tons of blood supply and lots of nerves, and then it kind of starts to thicken up and turn into regular tissue. But you don't want it in a place where it's outside of that wound and growing in this larger capacity. So yeah, granulation tissue, not healthy in that sense, but healthy in other places. So it's not
Hmm.
the enemy. It just isn't great where it is.
Right.
So when it comes to prolapse, there are different risk factors for prolapse. So one of the big ones is length of pushing duration. So we call it kind of a prolonged push or laboring when it's over 90 minutes, so over an hour and a half. Um, Most people don't push for longer than 2 hours. Okay. So even if you're kind of over that an hour and a half, but you're kind of under 2 hours, I think generally, at least from my own knowledge and experience, you're still roughly within kind of a normal, especially with a first baby, second, or if it's a baby that's in more that OP position or a different, the longer pushing phase makes sense, right?
Hmm.
But if you've done it before and your baby is just like set up in the right position and whatever, you would expect it to be hopefully more than 30 minutes to get your body to appropriate amount of stretch to reduce the amount of tearing, etc. But under an hour, you'd kind of expect that kind of shorter window of time. So from prolapse standpoint, pushing for a long time, genetics actually plays a fairly significant role. And then any pre-existing habitual habit. So like, are you constipated and do you push a lot when you go to the
Hmm.
bathroom? Or do you lift really heavy, whether it's people weight, boxes, weights, whatever, kind of strain when you lift repetitively? Do you already have kind of that biased pattern of movement, in which case it's going to set you up for more risk factor for prolapse? Those are probably the three big ones.
Yeah, that makes a lot of sense. So, do
Yeah.
you have like a certain way that you suggest your clients to push, or do you suggest a certain way
Yeah,
to push?
I do.
Awesome.
So, so even if you have, let's just talk about epidurals for a second. Okay. If you have an epidural, some people think I have to deliver on my back with my legs up in the stirrups. And that's the position that you see in the movies and you see in the pictures. And they think that's the position of delivering a baby.
Hmm.
That is a position of delivering a baby, which is true. And if there's a medical need to be in that position, or that's the position you want to be in, and you've been taught about others, and that's the one you want, that's fine. Okay.
Hmm.
However, when I coach people, typically what we're talking about, even with an epidural, is first talk to your doctor or your team, your midwife, whatever, wherever you're delivering, and ask, am I limited to certain positions when I have an epidural? Guaranteed, when you're in the hospital, if you have an epidural, you will be limited to a bed. That doesn't mean you're limited to laying on your back. It just means you're limited to being in a bed. And there are many positions you can use in a bed that are better than laying on your back with your feet in the stirrups. So kind of education on that. So when you have a baby that is that sunny side up, that face up position, we want it to be the opposite so the head can come through. You know that. I don't know how much you talk about that on your podcast. So positionally to help that baby kind of cross through birth canal. The tailbone, I'm like using my hands for someone listening. They're like,
I
what in
love
the world?
it.
The tailbone, if you're laying on your back, is kind of hooked up like this. Okay. So basically, if the baby's head's coming down, it has to go up against gravity and then out.
Right.
Okay.
So it's
If you're
kind
laying
of like going over like I'd say like a speed
a
bump
speed bump.
almost.
Yeah.
Yeah,
Yes.
but it's got to curve around up and over that speed bump.
Yes. So basically, the load of gravity is pulling that baby to keep it stuck behind your tailbone. And you're having to push that baby up and over, which is way more work,
Hmm.
whether they're face up, face down. it's way more work. So if you can get into a position that doesn't lock your sacrum, which is kind of the part right between your butt cheeks, I guess, to kind of make it like regionally, there's like this joint that's there. If your sacrum is kind of anchored against the bed, it doesn't have mobility to move. A position that would be better if you're like, hey, I'm so exhausted, I can't hold myself. Okay, then let's get into your side. The side at least allows the sacrum to move, and it doesn't require as much of this kind of over the speed bump, tailbone speed bump, so to speak. So you can lay up on your side. It could be easier to deliver a baby that way, as long as that's a position you're comfortable with, and you can have a partner hold. There's tons of ways to kind of be supported in that position. There's also kind of a squat bar, and I love a squat bar. If you can be upright, do it. That's amazing. The nurses know how to position the tables that way. They're designed to do that. It's very okay to do as long as you're comfortable. And there's also turning around and having your arms like on the edge, the end of the bed, like you can be kneeling. Those are really great kind of standard birth positions with an epidural in the bed. So when you're pushing, whatever position you choose, research does show that the position you choose to deliver in is the best position for you to deliver in.
Yes.
So whatever that is for you, hard to know what your position is that you choose when you don't know about other positions. So educate and find somebody to help teach you that there are others than just on your back that are easier to do. So my first recommendation is get out of that basic stirrup on your back position. Find a new one. Change positions as much as you want. That's fine. There's people to help you do that. And then when you're pushing, wait as long as the epidural is low enough that you can feel. Wait until you get the urge to push. Otherwise, breathe normally, breathe slowly. There's lots of different ways you can there's so many different techniques and things that people teach. They teach hypnobirthing. There's like a whole gamut of things. If you're not into hypnobirthing, then just breathe, relax your body, listen to calming music, talk to somebody, whatever it is, look at pictures on your phone, watch a movie. You might kind of have moments where you're not paying attention, but then you can, my favorite's Hallmark, because you know how it's going to end. It's like if you miss something, it's no big deal, right? Just get on board. So just do something to kind of pass that time until it gets intense enough that you're really not wanting to do that. So when you get to pushing phase, not holding your breath is probably the top thing that I recommend people to do. That is often coached in a hospital setting. And that is the hold your breath, push your chin up, bear down, and push for 10 seconds. That's like the standard that we're kind of taught, right?
Oh, yeah.
And that positioning is probably one of the worst ways that we teach to push. There comes a time when you might need to hold your breath at the very end, like when that baby's crowning and you're just like pushing with all you've got. Okay, great. Hold your breath, do whatever you need. But if you're doing that for an hour, 4 hours, whatever that is, you're setting yourself up for bigger complications, more severe tearing, possibly, prolapsing, and a change in vitals because of oxygen, right? So you're holding your breath a lot, and so the oxygen to baby and yourself can change. So there's multiple different ways that we can kind of avoid pushing in a way that could lead to, doesn't mean it will, but could lead to more complications or a more challenging birth experience.
Right. Definitely. And it's crazy because that is typically just the norm.
Yes.
And I've heard all kinds of excuses like as to why they're doing it. And there's so many providers that just say, that's just the way we do it. That's how you give birth to your baby. That's the only way that you can give birth to your baby. Do you want your baby to come out? That's the only way to do it. Because a lot of moms go in and they're like, I absolutely don't want coach pushing. But then once you get in that moment, it's like,
that's exactly what happened to me. That's exactly why I was pushing every 30 seconds or whatever it was for 10 seconds, because you just can't fight it in your own head. You're there and you're just doing it because you're like, I don't know. It's so intense. I don't know what else to do. So looking back, I'm like, I knew better. Like, what was I doing? But that's just what the coaching was. And having a coach, a birthing coach, which is what a doula is, or in my case, a physical therapist. I'm not a doula, but I know all about at least the delivery side of things. That's where somebody like that comes in handy. And even if you can't afford one, or you don't want one in the room with you, you can still find education before you go, right? So you can have, I don't know how you book out things, at least for me, you can have a session one time where you can get a bunch of resources and you can learn a bunch of information and you can decide what you want to do, but you can at least scratch the surface of learning and know that there's so much more out there, and that can change and improve your birth experience by a lot.
Yeah.
Probably one of the top things that I do tell my patients or my clients, depending, is if you have a doctor that's not listening to you, you are very much in the right to get a second opinion, and that's okay. It doesn't mean
Definitely.
they're a bad doctor. It just means that they're somebody who may not have the information or the knowledge or the patience to allow you to have a still safe, very medically appropriate birth experience that just doesn't align with the way that they were educated or the timeline that they want to put on birth. And it doesn't mean that
Exactly.
they would get your baby out safely. They probably will. They will. They
Yeah.
just might not get it out in a way that you want, or that lowers the amount of trauma that you're experiencing, or that limits the amount of risk for C-section or whatever that you have.
Yeah, exactly. I know. And I think it's important to discuss that too, because I mean, a lot of times we feel like we don't have another choice
Yep.
or we're bound to our insurance and this one doctor. But with a little digging, I have found that's not always the case. So
No.
typically there are other options that you might not have thought about. And you're right, it is helpful sometimes to reach out to a doula, and it doesn't mean you have to hire a doula, but like
Nope.
I get messages all the time on Instagram from people just asking questions, and I'm more than happy to answer questions because if I have the knowledge, I'm going to give it to you. If I don't have the knowledge, I'm going to find somebody who does and then give
Yep.
it to you. Because
And
I
it's
feel
so
like,
easy. Yeah.
yeah, I feel like this information shouldn't be safeguarded, we should just
Mm.
all have access to it. So, yeah.
I 100% agree. I get on a soapbox when it comes to education too. And that's why I'm so passionate about teaching people, is because there are, I would say, the vast majority of women, or just birthing people in general, would
Mhm.
just doesn't know any of this.
Right.
There are there's a small pockets that really educate, and they're out there, they're learning and Googling and whatever, but most of them have either had access to a doula before, had a friend who's had a doula, or pelvic PT, or exposure to some sort of educator in that sense. um, has some exposure that they know that it's there and how it can be helpful. And if you
Hmm.
haven't had exposure to that, you're just like, well, I'll just deliver how my mom says. The doctor knows, you know,
Exactly.
and the doctors know how to deliver a safe baby. They do.
Yeah,
That's what they're trained to do. They're trained to keep everybody safe and to not have any deaths on their hands. And that's amazing. Like, I'm so grateful, and that's amazing. They do wonderful work. Okay. But in this day and age, especially, as society kind of yo-yos, right? It went from fully natural, no epidurals ever, and then epidural was born, and all of a sudden, boop, now we have epidurals, and now the standard of delivery is different, and now we're kind of in this downward turn a little bit more, where we're kind of coming back. Not everybody, obviously, but more people are coming back into this. Wait, can't we do this naturally?
hmm,
A lot of other countries still do. Like, why are we doing it this way? Why are our C-section rates way higher than other countries' rates? Like, what's going on with that?
right.
We're delivering babies the same way. Like, we're still females. We have the same anatomy. What's going on with that? So education, education, education is so key.
Definitely. No, I totally agree. And so, how do you, like, if somebody's coming to you, how does that work? How do you help them if they're like, I don't even know what's going on with me, but I feel like something's not right after I just gave birth? How would you navigate that?
Yeah. So I will say this before I answer your question, and that is, people say, when should I see a pelvic floor provider or physical therapist or whatever? The earlier, the better. They say, well, I'm
Hmm.
not even pregnant yet, but I want to be pregnant. Great. We'll get a baseline. We'll know where your body's at. We'll know the weak points that we need to work on so that pregnancy goes better, postpartum goes better. And they say, oh, well, I'm pregnant. I'm not even postpartum yet. I'm like, great, you're pregnant. Let's work on it now. Let's get you set up. Let's get you ready for delivery, etc. And say, oh, I just had my baby. Oh, maybe it's too late. Nope, it's great. This is the perfect time. Let's start now. Let's get you, so you're so there's really never a bad time. But the earlier you find out about it and the earlier you want to start, the better. It doesn't mean that you're getting care that whole time. It just means you're getting a point of care, and then you're getting another point of care, and then maybe you're getting a bunch in a row, and then maybe you're taking a break, and then you're coming back to it, right? And that's okay. That's how recovery is. That's how the bodies are. So that's my first caveat. So from postpartum, um, there's a ton, and it's variable depending on what happens with birth, delivery, what people's goals are, how fit they were before, etc. First and foremost, I would say you have a 6-week period of time. I'm putting that in air quotes for those who are not watching me. A 6-week period of time based on a standardized research mass amount of people. Okay. And it's really an inaccurate timeline. What it's more often than not looking at is, are you still bleeding? And is your uterus roughly back to the same size that it was before pregnancy? That's what that phase of time is kind of talking about. And so they're saying, well, once you're past that 6-week point, you're good. You're ready to roll. And I say, not necessarily. Some people may be done bleeding at 3 weeks and they may think, well, I could just go back to doing everything. That doesn't mean that you're ready. That doesn't mean the uterus is down. That doesn't mean the organs have really come back into place. Your body has gone through so many physical changes during pregnancy that are not involved in your pelvic floor, that are involved in your rib cage mobility, your spinal mobility, your hip flexibility, the strength in your booty. You think mom butt. You think mom butt, the flat, like, I don't have a booty anymore. Oh, it's because I had a baby. No, it's because you lost strength there because of how your body shifted in the muscles you were using during delivery. So there's a lot of things that I work on with people postpartum, but the biggest thing is your body needs rest. It needs rest with certain doses and small amounts of incremental movement that set the foundation for when you're actually ready to start introducing whatever that activity is that you want to get back to. And everybody's different on that, right? So the first steps are coaching them through, how do I rest? How do I work on just basic, simple, functional movements on how to lift my baby up without aggravating back pain, getting my pelvic floor in the right position? How do I even feel if my pelvic floor is engaging? What do I do if I had a tear? How do I monitor and make sure I'm not having an infection or this is normal pain response? What do I do if I had a C-section and I have a scar there, even if it's not infected? How do I keep that scar tissue moving so that I'm not kind of in this debilitated, pulled over pain position because of kind of contracting? And that normal healing, it should do that. It should kind of bind down. That's what it's supposed to do. But we want to stretch it as it does that. So we have good mobility. How do I return to sex? Like, oh, 6 weeks, I'm cleared for sex. Great. I don't want to have sex now though. Like, it hurts now. What do I do? So there's so much that I teach people how to do scar tissue work. It's hard to be specific. There's so many different needs, but hopefully that just broadens the understanding of people when they're thinking postpartum. Doesn't just mean I'm done bleeding and ready to exercise again. That's part of what I do too, is coaching the exercise return. That's a super fun part. But many people are not ready at 6 weeks for that.
Yeah.
At least in the way they're thinking of. Yeah.
I love that, because I think a lot of people think, well, I'm doing my Kegels or I had a C-section. I don't need pelvic floor therapy. But it's the opposite. You really do, because a lot of us are not really in tune with our pelvic floor like we should be, I feel like. And we just don't think about it because it's not talked about. We don't even understand what our pelvic floor is, what those muscles are. So yeah, I think that education on even what that is so invaluable.
Yeah, the pelvic floor is not a muscle that works in isolation. So when you think about, like, you can bend your head forward and bring your head back up, or lift your arm up and bring your arm down, and it's relatively not much else, so your body moves. But every time you do one of those motions, your pelvic floor activates. So your pelvic floor is utilized in everything you do, even as simple as breathing. So breathing is the foundational exercise that I do teach people. And people are like, well, I breathe. I'm like, okay, great. But you probably are breathing with a pattern of breathing that isn't actually ideal because of how we sit and our posturing. And just there's so much, especially in our westernized country, that we're just not as active. We don't move the same way. It's just morphed over time to more desk and more sitting and inactivity and all those things. So, and even after a baby, our ribs kind of flare to make room for that baby. And so everything's not in an ideal position. And so breath, even just the simple act of breathing, utilizes your pelvic floor. And so when people think, oh, I'm doing Kegels, I'm like, great, but Kegels actually might make your symptoms worse. So Kegels are not the answer. Kegel are a form of exercise, a very early on phase of intervention. But if that's all you're doing to rehab your pelvic floor, there's probably a lot more we could be doing. Yeah.
Yeah, I love that. Well, thank you. I appreciate that because I think it's important that we just get that message out there.
Yeah.
Instead of
It's
just
a
doing our
popularized
Kegels.
term. Yeah.
Yeah,
Kegels are like, oh, I know what Kegels are. I'm like, great. Do you know why you do those or what they're for? So there's a lot more to
exactly.
it. Yeah.
No, I love that. So before we kind of wrap up here, is there
Mhm.
anything else you would love to add?
Hmm. Oh, I could talk for the pelvic floor forever, but I guess just in summary, I will say this. The more prepared you are and the more educated you are on the different possible outcomes of birth, then it's not a surprise if they arrive. So if you go in with this one mindset of what you know will happen, but then it's something that's different that you haven't ever learned about or haven't talked about, you're like, oh, this I failed. This birth was not like it becomes this emotional. You're already emotional. You had a baby. There's like so much going on. But if it's something that you've discussed and you know is a possibility, then it's not this outlier anymore. You're like, we planned for this possibility. We knew that this was possible, maybe not as likely, but possible. Maybe you had to go to C-section for some reason. Okay. You knew about C-section. You knew about some of the rehab steps that you need to do to help make that more realistic for postpartum, how to cough, how to poop, how to hold a baby, how to nurse a baby when you have that, all the things, right? And so if you are educated, if you know at least something, you don't have to know everything. If you know at least something, it can make those unexpected outcomes not feel unexpected. It can make you feel more empowered. And then your postpartum experience, having that new baby will be so much less stressful. And you can just breathe a little bit easier, even though you're so fatigued and exhausted. Yeah.
Exactly. I love
Yeah.
that. That's a great note to end on.
Mm.
So, if somebody were to want to work with you, how would they go about doing that?
Yeah, so I have a website you can visit. It's www.flooredpelvichealth.com. I also have an Instagram, which is at Floored Pelvic Health, and you can email me at info@flooredph.com.
Love it. Okay, awesome. Thank you so much for joining me today, Sarah. I think you put so much amazing information out there, and this is going to be amazing for somebody. Thank
I'm so
you.
glad. Happy to help.
Thank you. All right, we'll chat soon.
All right, bye-bye.
Bye. Oh my gosh, I feel so honored that you took the time out of your busy day to listen to that episode. I really hope that you liked it or something resonated with you or you learned something new today. Make sure to hit subscribe so that you don't miss an episode. And if you'd like to connect with me, go ahead and go to the show notes and click the link. I'd love for you to rate and review this show. That helps more people see this show when they're searching. Thank you so much, and I hope you have a beautiful day. I will see you next week.